For more than 100 years, Loma Linda has served as a haven of hope, a center for healing, and a place to help make man whole. When Loma Linda was teaching medical students in its accelerated program for the World War II effort, a leader was born who would someday guide others in transforming lives at a world-renowned institution. But little did she know. Lyn Beherens was born in New South Wales, Australia. Stricken with rheumatic fever as a child, she was bedridden for nearly a year.
She was not able to run and climb trees and do things like I like to do. She had to spend a lot of time just, sitting and doing quiet things.
No one knew if she was going to survive. During that time, Lyn made a commitment to God. She would spend her life serving others. Her goal was to become a missionary doctor in Africa. Soon after she made her promise to God, scientists discovered a method to produce penicillin in mass quantities. The wonder drug made it to her doorstep, and the young Lyn was on the road to recovery. Now, she wanted to live her dream. Unfortunately, money was tight in the Beherens family.
She had always wanted to be a doctor, and we didn't think that that would be a possibility because funds were not available for her to go to university.
She prayed that if God wanted her to be a physician, financial resources would become available. His answer was clear. Lyn received all her education, including basic living support, through scholarships.
We didn't have a telephone, and so we would have to go up to the corner where there was a payphone, and this is how she got the news that she had passed and been given these awards. That was very exciting.
She completed her medical education at Sydney University's School of Medicine, and in 1966, Dr. Beherens became Loma Linda's first pediatric resident. 4 years later, she returned to Loma Linda as a pediatrics instructor, about the same time when President Nixon announced the construction of the new Loma Linda VA hospital.
And as I think of the desire all of us have to have a world of peace in which people of the world can work together and live together rather than to fight each other, I think of nothing that does more to make friends for America abroad than that kind of selfless service by people like those from Loma Linda who have gone out through the world as they have gone out.
Dr. Beherens obtained many other firsts at Loma Linda. She became the first woman dean of the School of Medicine in 1986, just 2 years after Loma Linda University Medical Center became known worldwide for Baby Faye.
The doctors who transplanted the heart of a baboon into the body of a 2-week-old girl yesterday said tonight the infant's condition is improving and they're now optimistic about her chances for survival.
The heart of a baboon is now beating in the chest of the infant known only as Baby Faye, a 14-day-old girl who surely would have died, say doctors, without the historic transplant. Surgery at the Loma Linda University Medical Center east of Los Angeles lasted just 5 hours yesterday.
In 1990, Dr. Beherens became the first woman president of Loma Linda University Adventist Health Sciences Center.
You know, we talk a lot about first ladies in Washington, D.C. First ladies are very important, but in the community of Loma Linda, they are important as well. Lyn has played a magnificent role in expanding the work of the university and making a difference on behalf of all of those who spend their life improving people's health.
As the longest-serving president in the institution's 103-year history, Dr. Beherens paved the way through many milestones. Through her visionary leadership, Loma Linda expanded significantly during her presidency. In 1990, Loma Linda opened its doors to the world's first hospital-based proton therapy center to help treat cancer. Since its opening, the center has treated more than 12,000 patients and, until 2003, was the only cancer therapy facility of its kind in the United States. Just 1 year later, the Behavioral Medicine Center opened, with 1 in 4 Americans living with a mental disorder and 1 in 14 Americans addicted to alcohol. The BMC heals and restores hope to nearly 30,000 people a year. In 1993, the vision of a major new children's hospital in Southern California became a reality. It is the region's only Level 1 trauma center, serving San Bernardino, Riverside, Inyo, and Mono counties, home to 1.2 million children. Soon after, the Drayson Center opened. As Loma Linda's Recreation and Wellness Complex, the 100,000 square foot facility promotes physical, intellectual, emotional, and spiritual wholeness. Dr. Beherens continued to make important contributions for health education by establishing new schools of pharmacy, science and technology, and religion. She has assisted in successful capital campaigns for much-needed expansion of facilities. These have included Chan Shun, the Coleman Pavilions, Wong Curley International Conference Center, the Centennial Complex, and most recently, the Tam and Vai Zapara Rehabilitation Pavilion. Although she never became a missionary in Africa, God used her to impact the world through Loma Linda. Dr. Beherens traveled to Africa many times since Loma Linda University joined Adventist Health International, an organization committed to partnering with healthcare services in developing countries. It has more than 20 hospitals in 12 different countries.
Dr. Beherens is a classical, frustrated, wannabe missionary. That was her original plan. She never had a chance to realize those, but it's been my pleasure and enjoyment for a number of years now to travel with her. She enjoys working across cultural boundaries, of sensing the excitement of encountering new situations and so on. So, and the commitment from me, and she's after this, is that she will be able to continue to be involved with international activities into the future.
In 1994, the institution celebrated the opening of Sir Run Run Shaw Hospital in Hangzhou, China, a hospital that Loma Linda helped to establish and manage. A 400-bed Western-style teaching hospital, it was the first of its kind in China.
To have moved from a greenfield, which is what it was to begin with, to a 3-tower, 1,200-bed facility that is the first public hospital in China to receive Joint Commission accreditation for endorsement of quality is unbelievable. Wonderful friendships, wonderful relationships, and we have learned so much. And what a privilege to have crossed the cultural barriers, to reach across the Pacific and form relationships. It's been a real joy.
We are widely known by the whole country because we follow the standards of the JCI.